Cytology, histochemistry, immunohistochemistry. So these methods, it's basis for any histology lab around the world. First method is cytology. It's this method used for analysis individual cells, and this technique quite simply, and this easy to this method easy to use in some strict environment, in strict resources. Um, Usually, it's these slides, cytology slides, easy to prepare. You take some impressions, scraping or smear on glass, and this on this surface we make some preparation like drying, staining. This probably more easy than usual histology. This method used for smears from gynecology, from upper respiratory tract, for use for liquids from abdominal cavity, from pleural cavity. It's liquid which contain individual cells, not solid tissue. It's also it's very fit with tissue, small amount tissue, like from cyst, from thyroid gland, from breast. It's very easy to make this smear, distributed these cells on glass, and continue in study under microscopes, light microscope. It's a return to material. This is smears, scrapings, imprints, punctate, and liquid samples. This uh, this method use in some respiratory disease because it's sputum or some fluids from respiratory system. Easy to prepare these impressions or scrapings. Uh, Also, we talk about some material from tumors, especially cystic tumors or tumors with huge amount of mucin. This Also we can use simple syringe for take small amount material. This method it's not so invasive. It's advantage of cytology. Okay, we take a syringe and take some puncture, make some puncture, and take a small amount of this cells, tissue, and make this punctate spread on glass, and trying to make this very tender, very delicate for preserve some connection and structural relationship between cells. This looks like that. It's traditional Romanovski-Giemza staining. It's probably most often staining in Ukraine. And we reserve these tissues, these individual cells from probably tumor. It's this complex, but it's look on this cell. It is probably macrophage. with some granules inside because this stain very sensitive to granular structures inside of these enzymes inside of cells. Yeah, it's cytology is not precise method. It's very difficult to make some very clear or precise um, description, this conclusion about this tissue. But we surely investigate this nuclei of these cells and search some atypia signs, search for inclusions inside of this nuclei. Look at on cytoplasm and compare with normal or abnormal tissues. It helps to evaluate tissue very quickly. A huge breakthrough in cytology was Papanicolaou methods. It's simple methods for screening in gynecology. There's some scraping from cervical channel or cervix and the vagina. It helps distinguish some early signs of oncology. It's very simple and very quick to make some primitive screening and make decisions. This case need additional investigation or seriously with additional methods, or it's always okay. It's according Papanicolaou, it's some 5 grades, 5 classes of this structure. This classification moved to typical Bethesda system. It's which nowadays it's prevailing around the world. First class is normal structure, normal cells. This second class, it's cell grade. It is we find some inflammatory signs of inflammation. Next, it's third class. It's suspicious tissue from malignancy, and we find some signs of abnormality in nuclei or cytoplasm. For grade is we have admit some clear signs of abnormality, malignancy. Usually, it's for simplifications like corresponds to benign tumors. So short grade class is corresponds some pre-tumoral disease, and 5 class or grade is it's we can say confidently it's typically cancerous cells. It's any some adoption about diagnosis. It's probably as I trying to explain simply words, but it's better for understanding. It's typical Papanicolaou stainings, smears from gynecology tract. So you can see different coloring with different epithelial cells and some cell lining from cervix, etc. And in US, it's we know about Bethesda University, Bethesda Medical Center. It's this sense of leadership around the world in cytology, and this classification of general general rules about this cytology, and this according this classification, this we evaluate adequacy of sample type, categorization. It's like precancerous, benign, malignant, normal tissue, and we based on this sample, we can make some interpret interpret some results and make prepares a recommendation. Okay, next chapter is histochemistry. Histochemistry. It's branch of histology, and main idea of histochemistry is we identify some localization of various chemical products of metabolism in tissue. Based on this chemical detection of chemical substance in cell and tissue, we can conclude about pathology on normality of cells and tissues. We can able to stain fat, glycogen, nucleic acid, nucleoproteins, minerals in tissue, and this knowledge help us make some pathology conclusion. For histochemistry, of course, we have some difference from typical histology. Histology based on rough this rough fixation into alcohols, into xylines. It is often lead to destroying fats or some complex chemicals, which easy to destroy by xylene or strong alcohol. For histochemistry, we need special fixation like Carnot liquid based on acetic acid, an example, or cryopreservation. And also we need some control in this for providing more precise results. It's some narrow field information. It's types of histochemical reaction. Probably this information used for tests. It's microchemical. It's a type of histochemical reaction when we under using some chemicals for investigation. We push this tissue for formation new product in tissues. It's example of Perl's reaction. It's we use this reaction for identification of iron ions in tissues. It's results of some hemorrhage, etc. It's can distinguish hemorrhage from melanoma, for example. Next type is formation and new color. A typical representative is period shift, periodic acid shift reaction. In due this reaction, in tissues formate shift reactives, shift compounds, which create nice pink or reddish color. Third types is electrostatic staining, which the dye or some chemical component by electrochemical, electrostatic interaction. This stuck in some on surface some chemical compounds. It's like uh, hematoxylin staining nuclei, or probably also hematoxylin in some case can stain cytoplasm. Uh, and next fourth type of reaction, it's when under the influence of external chemicals, we can solve something in tissue. Example is Sudan dye, Sudan stain helps us solve fats in tissues and use this reaction as we can change it color. It's next demonstration. It's this histochemical reaction by I prepare by my hands. It's from my practice. It's bones. Uh, it's after fracture. And this Van Gizon staining helps us collagen. Uh, we can visualize collagen in place of uh, formation new bone. This this is pass reaction in hot well. This reddish or uh, pink or raspberry. It's difficult to evaluate. It's some subjective uh, color in its sign of uh, carbohydrates formation in this tissue, and there's some uh, pathological reasons. This is corporal amylase from prostate gland. It's staining. This amyloid staining by Congo red, and additional I use polarized light in microscope for establish some this apple green color. This is not so big amount of this phenomenon, but main phenomena is in this sample. It's sign of mild cross. It's probably not so clear and quite primitive, but we can see this cross, this structure formate, and this polarization, this light in amyloid structure, because amyloid structure have beta sheet structure. It's like this, like on a roof. uh, this is like gofra or something like that. This regular structure and these photons change direction and formate such picture. A lot of it need a lot of physical chemical background for clear explain this mechanism of formation. I'm very keen in this field. I make a lot of this statements. And firstly, I read about this phenomena, but it's not in okay. Uh, 15 years ago, it's not so easy to find in internet. I staining and find identify this phenomenon by reading books, not compare with some examples. Okay, next histochemical staining is ocean blue. This is used for identify this stain used for identification routines and it's very useful for verification of metaplasia. This is example is stomach because this is blue color. It's witness for intestinal metaplasia. This staining um, we make this staining in acidic environment, acidic pH. In acidic pH, these butyns transform in something blue. As we can see, these goblet cells, individual goblet cells, full of butyn. And also in the lumen of these glands, full of these butyns. Next is Foncos staining. This staining for identification calcium ions, calcium phosphate ions. Usually, most of calcificates in tissues hydroxyapatite forms. It's very close to chemically very close to bone compounds. This, but it's this hydroxyapatite have different levels of maturity uh, in compost staining. Also, I read in books and make nobody teach me. I use books for reconstruct this staining because it's not easy because it's chemical for this pink color. It's very rare. I bring this fast red from Sweden. I asked him some old professor this staining this chemicals was from 70s, very old, but like we can see, it's still working. It's amazing. Okay. In this method based on the silver, using silver nitrates, we know from chemistry silver nitrates is soluble, but under some reaction is use light from simple light like we use in rooms in our offices. It's under lamp. This exposition under this light and silver nitrates in tissues leads to formation this brownish, dark brown color of this deposition. Okay, it's quite easy methods, but also need specific dye. It's alizarin red S dye. This is features of this dye. It's we can use for calcium ions identification in a very narrow period of pH. pH 40.2, pH 40.5. It's we use pH meter for this working this dye in tissues. It's also prostatolite in prostate. Prostate gland formate some stones. And it's part of my second PhD. It's I make also a lot of these things, and then now I have demonstrate something picture. Okay, next is immunohistochemistry. Is a staining of spinal cord that I make in my lab. This we use several dyes. It helps to identify neurons, nuclei, and some membrane proteins in the axons. It's reddish. In some place we can identify these neurons in the spinal cord of mice. Um, okay. Immunohistochemistry is quite different. This method was introduced in mid of 20th centuries, based on a reaction between antibodies uh, uh, and this antigen antibody reaction in Albert Holmes. It's make some observation, and yeah, this invention in basis of this invention leads some labeling antibodies with some fluorescent. Later in 1975, developing of hybridoma technology leads to um, intensification and the next level production of this antibody. It's more highly specific antibody. Hybridoma is tumor from B lymphocytes, which uh, growing in mice, and when by some genetic technology, when we scientists incorporate gene inside of this hybridoma, this hybridoma continuously produce very specific antibodies in quite large volumes, appropriate and make possible some routine clinical practice. Okay, nowadays it's another new technologies don't need produce specific tumor in the genetic operation for implementing these genes. It is make some artificially these antibodies. Uh, Immunohistochemistry can be performed on fresh or paraffin embedding formalin fixed tissue samples. Its first application of this technology was direct methods. It's when the antibody and antigen and some fluorescein or some tag which make visualization of this reaction. But later, and nowadays, we use indirect methods which use additional antibody, primary and secondary. It helps us intensify signal and very clear see its reaction true or false. Based on this indirect method, we distinguish primary antibodies, which search its short-term antigen into tissues, and secondary antibodies, which react with primary antibodies, build this tower for we can see under microscope in case of positive reaction. The most widespread chromogen which help us admit this reaction is diaminobenzidine. It's also this alkaline phosphatase use, IEC, and couple another types of this or fluorescent tags for fluorescent microscopy, like I demonstrated in, in this first slide of this chapter. This we can see this antigen, primary antibody, secondary antibody, and this chromogen. In case of this reaction, we wash tissue. If reaction not true, this construction removed from tissue. But if we have tight union junction in this construction, this tree continue grows on this surface of cell or tissue or these fibers, and can activate chromogen from invisible to visible. This two aggregate condition of diaminobenzidine. So we have invisible benzidine, diaminobenzidine, in some reaction of visualization, this change structure and became brownish. Okay. For diagnostic, we have several types of reactions. First, it's nuclear reaction. It's typical for estrogen, progesterone, TTF1, both nuclear and cytoplasmic reaction. It's I not like these antibodies because it's not so clear. It's a lot of it's create more background. Next is reaction with cytoplasm, like cytokeratins or thyroglobulin. Another good example of clear reaction is membranic reaction. HER2 in breast cancer, an example, or CD45 for lymphocytes. Some antibodies have both in react with membranes of cell and membrane structures inside of cytoplasm. It's CD30, CD15. It's for Hodgkin cells, an example. It's typical reaction. It's both of these antibodies react with it. And some antibodies react with fibrillar structure outside of cells. It's different type of collagen, laminin, elastin, etc. Then all of this immunohistochemistry is we establish tumor origin when we collide, find something solid structure without no idea what is this, and we staining on some fibrillar structure, membrane structure. It's some typical epithelial antigen or this blood cell antigen, and we can establish origin of this tumor and find primary tumor in organs. If we find metastasis, this is immunohistochemistry helps understand this tumor can react with some chemotherapy. It's an example in breast cancers we use estrogen, progesterone, or HER2 antigen for establish what type of tumor. And this verification help us to establish what this tumor, what how to treat, what these therapeutic agents we can apply for chemotherapy. And also we have many biomarkers for prognosis of disease. For example, is P53 or E67. We can indirectly establish malignant potential, aggressivity of tumor, can predict outcomes. Okay, okay. Thank you for your attention. It's all.